Hello, my name is Gabriela, and I am delighted to present our paper on the co-design of health data representation for older adults on behalf of my co-authors Valeria, Angeles, and Andres. This study was developed with older adults from Ecuador and Chile. Recording and displaying health data is becoming increasingly important, with technology enabling the monitoring of health data, for example, by using a smartwatch. Mobile technologies that enable the recording of health data can benefit the healthcare of older adults. For example, in maintaining healthy lifestyle or for assisting in medication management. Health data have generally been represented using simple statistics or graphs. Many of these representations are far removed from the interest or experience of older adults, as most visualization mainly focus on the researchers, medicals, and caregivers. Previous HCI research has sometimes focused on the negative aspect of aging, while other fields of research, for example, critical care ontology, aims to expand our view about aging, promoting positive identity and focusing on the capabilities and skills of older adults. In this work, we aim to co-design health data representation with older adults, allowing them to imagine, explore, and create representation of health data through the presentation of personal objects. The context of our study is in South America, more specifically both Chile and Ecuador. In both countries, the population of older adults has increased. In Chile, by the year 2050, the population over 60 years of age is expected 30%. While in Ecuador, by the same year, there will be more than 3 million of older adults. Religion plays an essential role in both countries' social, political, and cultural lives. Moreover, they were countries that prioritize the collective interest over individual ones. Most Chilean and Ecuadorians, older adults, live with their family or with close relatives. Regarding of the use of technology among older adults in Chile, the possession of a smartphone by older adults increased by 40% and the internet by 20%. In Ecuador, 42% of older adults own a smartphone and only 19% own a computer. The under-inclusion of older adults in imaginative and creative process when thinking about health technology, especially older adults in the geographical context of our study, who are underrepresented in the HCA research, led us to propose the following research question. The first, what representation of health data can older adults in the Global South imagine from personal objects? The second question, what considerations should we take into account when co-design online with older adults? In this paper, we propose a co-design approach for older adults to create representation of health data through the presentation of personal objects. In particular, our approach focuses on providing a set of simple materials, for example, paper, pencils, modeling clay, to encourage creative thinking. The contribution of this paper is twofold. First, we share insight into the design of health data representation for older adults in the Global South. And second, we reflect on co-design online with older adults and lesson learned from this distance, the design experience. We organized a remote co-design workshop to engage older adults in Chile and Ecuador in the creation of health data representation and technologies. To recruit participants, we use snowball sampling. Prior to the online session, a box of material was sent to each participant. The material consists of pencils, sheets of paper, and eraser and modeling clay. The online session was conducted through the Zoom platform. Our participants were 18 older adults, 7 women, and 11 men, aged between 6 and 17. 12 participants were married, 4 were widowed, and 2 were divorced. Most of the participants had completed their university education. Of the 18 participants, 13 were tired and the rest were still working. During the online session, participants carried out 4 activities. First, they were asked to introduce themselves. Second, they were encouraged to think about different types of health data. To do this, we asked them about their health and how they currently use technology to help them with their aliments, for example, alarms, calendars, doctor's notes, and a specific health device. Third, we ask participants to choose 3 personal objects, present them, describe them, as shown in this picture. They present objects such as keys, chains, watch, or wallet. When we ask older adults to imagine health data representation, they conceptualized the following 3 main themes. Our first theme talk about how health data can be represented. For this theme, we found 2 sub-themes. First, we found participants imagined embedding technology in everyday objects that are frequently used, such as a bell or ring. So participants don't know. The second sub-theme is the participant do not necessarily want information with a statistical or graphical representation. Our second theme was the creation of technological device for health monitoring. For the second theme, we have 2 sub-themes. On the one hand, health device connect to their contextual factors. Participants imagine the technological device form, where they would wear it, and what data they would like it to collect. They create devices such as a crucifix or bracelet. The device created were closely related to their beliefs and preference. The other sub-theme is about fashion sense in health data representation. Our participants are interested in the technology that don't overwhelm them and are not disconnected for their reality. For example, we can see in this slide, one participant decided for a bracelet. The third theme was resistant to technology. In this theme, we found that altering the participant's environment generates resistance to the use of new technological tools. For example, one participant shared his rejection of digital tools to make his work. He preferred to use a pencil and paper for his architectural design. They also navigate negative emotion about the tracking tool because these tools could generate pressure to meet goals. For them, this device could turn their life into a kind of machine. Our participants present different proposal and individual expectation about the health technologies. Regarding acceptance and trust in technology, participants have stated their interest in using health technology and its data representation when these technologies can be integrated into an everyday object they already trust. They want new technology that could not invade their natural environment. In terms of ideas for the design health data representation, our participants have also expressed a desire for health technology to display contextual information for easy interpretation of health data. Another suggestion is that the information they received should not cause the unnecessary worry or pressure to meet targets. Concerning personal and cultural connection, there is an apparent connection with a spiritual object and objects that make them feel different from others. Researchers and designers may consider these aesthetic choices alongside cultural fit in creation health technologies. In conclusion, the older adults propose suggestions for designing the health technology and data visualization. They have imagined representation of health data in analog format and picture where contextual information could be included. At the same time, they propose incorporating health technology into everyday objects that they already rely on. We encourage developers and designers to create technology that display interpreted health information and benefit older adults with lower levels of numeracy and health information literacy. Finally, health technology should be conservative and their design should take into account the cultural context and personal needs of older adults. Thank you.